My name is Alex Krotulski, and I serve as a research scientist at the Center for Forensic Science Research and Education, and I'm also the program manager for our NPS Discovery program. Typically, the majority of our work that we conduct is in the area of forensic toxicology. We also do SCIEX drug testing in the area of forensic chemistry. Often, we're looking for these new synthetic drugs, and we have a lot of information about trends. So today, we're going to talk about NPS stimulants and NPS hallucinogens. Typically, our laboratory will lump these two classes together based on the fact that the user population sometimes overlaps, and some of these drugs can have both stimulant and hallucinogenic properties. For NPS stimulants, the most prevalent substance we currently see is eutalone, and this substance has been prevalent since the enactment of scheduling by the DEA of N-ethylpentylone, the previous most prevalent synthetic stimulant here in the United States. This category of stimulants and hallucinogens can be very diverse. We typically see many substances within these two categories. However, most of the substances are not very prevalent. We may see some substances just 1 or 2 times a month or a quarter. The synthetic stimulant route has gone very similar to previous iterations, where you have the addition of carbon chains to a core structure piece of the molecule. Typically, it's going to look like a phenethylamine or a cathinone, while the synthetic hallucinogens that we see are typically going to be based off of other hallucinogens like ketamine and PCP. Right now, the NPS hallucinogen that we see the most common is 2,4-deschloroketamine. However, we do see some PCP analogs from time to time. These substances are prevalent in our forensic toxicology casework. They could be in DUID casework or post-mortem casework, but typically they're not going to be found as the only drug in a case. Polydrug use, especially with NPS and either other NPS or traditional drugs of abuse, is very common, and it's not too unprevalent for us to see these substances in combination with opioids or benzodiazepines.